6-point facial contouring, a global approach to shaping your face. Facial contouring is much more than just flattening a double chin. You also have to look at things such as the shape of the jaw, the width of the cheekbones, and the projection of the chin. Without carefully thinking about what you want, there's no way to know if the given procedure will produce the desired result. My approach is to first ask the patient what it is that they'd like to change about their facial shape. Once in a while, the patient will say the only thing they don't like is the bulge behind their chin. If everything else looks okay, then simply doing liposuction of the double chin itself will generally make that patient happy. However, there are millions of people running around with a flat area behind their chin who are still dissatisfied with the shape of their lower face. That's because it's actually unusual for the double chin to be the only thing wrong. The patient doesn't like a round lower face and mainly notices the double chin, so a doctor just suctions that and assumes the person will be happy. Without really asking the patient what they don't like about their facial shape, there's no way to discover that what they really wanted was a more angular shape. That means being able to see the jawline from the chin to the ear with a crisper neckline as well. This is where non-invasive treatments like cool sculpting or injections like Kybella fail. With those, there's no way to alter anything around the jaw or the lower part of the neck. Liposuction can precisely contour the entire neck and jawline like no other method can. For some people, a double chin is accentuated by a short jaw or weak chin. Here, a small chin implant is helpful to create the appearance of a flatter area behind the chin. This is something most patients hadn't considered until it was pointed out to them. A double chin is really something seen from the front, but I have plenty of patients who turn their head to the side to show how the area looks round with no definition. That's where facial contouring is helpful to improve the shape of the jawline and make it stand out more. Often without thinking about it, patients focus on the double chin as the cause of their entire lower face looking round, when fixing that alone wouldn't really help much. Then we move a little higher toward the cheekbones. The roundness caused by the double chin is only part of a poorly defined shape, which is also caused by round cheeks. Here it's important to think ahead a little. When you've got a smooth area behind the chin and a sharper neckline and jawline, the next area up should also have nice definition. That's where I find buccal fat pad removal to be a really helpful part of facial contouring. The last piece of shaping the face is in creating cheekbones that have definition matching that of the jawline. The reason buccal fat pad removal is so helpful for many people is that the angular jawline they want is enhanced by higher cheekbones and slightly narrower cheeks. Without letting that person describe what they want, there would be no way of knowing that buccal fat pad removal might be part of achieving their desired appearance. The result of buccal fat pad removal is higher cheekbones and a subtle hollow below them that defines them and creates a sort of parallel set of lines consisting of the cheekbones and jawline. It's a simple procedure often done with neck liposuction and results in an overall much more elegant shape. And by the way, all of this can be done in the office with just local anesthesia and minimal recovery. I encourage people to think more globally about the shape of their face so they don't focus too much on one very obvious thing. It might be that flattening a double chin won't end up looking the way they thought. If you have a double chin, try to think about your entire face, jaw, and neck, and what kind of shape you really want. Looking at photographs can actually be very helpful. Knowing what you want will go a long way toward getting the result you want out of facial contouring.